Myself, Dr. Wazif Akhtar Momin, Assistant Professor, Anatomy Department in Dr. MIJT Tibia Unani Medical College, Yari Road, Warsaw, Mumbai. I have completed my Bachelor from Unani Medicine and Surgery from Mumbai Tibia Medical College, and after that I have completed Masters in Surgery from National Institute of Unani Medicine, Bangalore. Today I come for my topic, current scenario of Unani medicine. Unani system of medicine found now immediate favor from the masses and soon spread all over the country. Presently 21 states, union territories in the countries have Unani hospitals and the setups for to treat the patients, and it is globally also spread all over the world. At present, total registered medical practitioners, those who are practicing Unani medicines, are all around 51,000 more or less, and total Unani dispensaries in all over India is around 1,621. Unani hospitals are present right now is 259. Unani medicine spread its roots from east to west, wherein there are the number of Unani wellness clinic being started around the globe. Traditional medicine has maintained its popularity in number of Asian countries like China, India, Japan, Pakistan. Current global market of the Unani and Ayurvedic medicine is estimated to be more than 100 billion of US dollar. Out of this, European Union account for the around 40% and Japan 20%, USA 10%. Global demand of Unani medicine. This is global need to cultivate and conserve medicinal plants. India has accepted Unani system of medicine is one of the alternative healthcare system and has given its official status. It is the largest producer of medicinal herbs. More than 13,000 plants have been investigated during the past 5 years. WHO new strategies will help to validate the traditional medicine practice at international level. Research frontiers. We'll discuss the research frontiers, the drug standardization and the authentications. These are the research frontiers, and it included the stability of the Unani drugs and validation of the efficacy claims of the drugs used in the Unani medicine. Standardization of traditional clinical procedures is also included in the research frontiers at present, which are researching in the Unani system of medicine. Present research status and the treatment leads in Unani system of medicine we have achieved in different medical diseases which are discussing right, and we can treat with the Unani system of medicines are the skin diseases like vitiligo, eczema, psoriasis, liver diseases, acute and chronic hepatitis in liver disease, musculoskeletal disorders like rheumatoid and osteoarthritis, sinus diseases like sinusitis, communicable diseases, malaria, and other medical problems like sexual disorders. For in Unani system of medicine, so many drugs are available. We can treat the problem and we can solve the issue with this issue. Now the efficacy of the Unani drug assessment. Efficacy of Unani drug assessment, which included the standard used in the compounding of the drugs. The official formulary of the Unani system of medicine has enumerated the certain general principles for compounding various drug preparation. They can be categorized into two parts. First is it's related to the routine process, and the second is a very specific process. This includes the process of powdering a drug to required particle size. And the third is the Kevam requirement. What is the Kevam? Kevam is the base for the Unani formulation for the drug, which includes the honey like sugar, vinegar or the alcohol, which can be the base for the Unani drugs. Required viscosities Kevam has to be developed in the base substrate in which the ingredients are to be mixed. Principles of the good storage. Different methods of the storage mentioned like airtight containers, closure system, glassware, plastic containers, china clay. for storage of some medicines. Empirical shelf life of the drug formulation. Unani pharmacopoeias have mentioned the shelf life of the various formulations, which is empirical. Keen observation and use of these formulations for the centuries has made it possible to evaluate the life of the formulation for its use. The expiry date of various drugs have been mentioned in the classical literatures of the Unani system of medicine, which serve, for example, the powder which we can preserve for more than 1 month. Tiryake Akbar we can preserve for more than 3 years, and Tiryake Farooq we can use it and we can preserve it for the 10 years. Barshasha has retained their potency for 5 years. Now we'll discuss the standardization of the drugs. Standardization is nothing but is a process resulting from the consensus basis on the scientific finding obtained by the parties most affected by it. Standardization refer to a manufacturing process, analytical test, operational procedures, calibration of the instruments or any set of the conditions which required for the purpose. It deals with the formulating and applying rule for an orderly approach to the scientific activity for benefit of it, with the cooperation of all concerned. Now come to the various components of the standardizations are authentication, foreign matter, organoleptic characters, visual characters, size, color, surfaces characterized like texture, fracture characterized and other characters like odor and the taste. For the macroscopic and microscopic characters, these should match with the pharmacopoeial standards. Loss on drying, and 6, this is the last, the total ash. So these all are the components of the standardizations, which also include, and we can also add in this standardization, the acids insoluble ash, extractable values alcohol and water, 9 heavy metals lead, cadmium, mercury, arsenic. The limit as prescribed in the pharmacopoeias lead that opium, cadmium and the mercury and the arsenic may be observed. 10 microbial load limits as prescribed in the pharmacopoeias: Staphylococcus aureus absent, Salmonella absent, Pseudomonas Escherichia coli absent. Total microbial plate count 105, 107 for the topical use. Total yeast and mold should be less than 103 per gram may be observed. Aflatoxin B1, B2, GI and G2. Chromatographic profiles and assay of the marker compounds. Pesticide residue, organochlorine and organophosphorus. For the purpose of the pharmacopoeia, pesticide is an substance or mixture of the substance intended for the preventing, destroying or controlling any pest, unwanted species, plant or the animals causing the harm during or otherwise interfering with the production, processing, storage, transport or marketing of the vegetable drugs. Now come to the GMP, means good manufacturing practice. In Unani system of medicine is the part of the quality assurance which assures that the products are constantly manufactured and controlled to the quality standard appropriate to their intended use. Quality management system, quality assurance and quality manufacturing, good manufacturing practice, manufacture and the quality control. 5 P's of the good manufacturing practices. What are the 5 P's in good manufacturing practices are the people, products, process, procedure and premises. Good manufacturing practice is a set of regulations, codes and the guidelines for the drug substance and the drug products, medical devices, in vivo and vitro diagnostic products and the foods. Objectives: guarantee high quality products to the consumer. Why GMP is important? A poor quality medicines may contain toxic substances that have been unintentionally added. A medicine that contains little or none of the claimed ingredient will not have the intended therapeutic effect. Governments seeking to promote their country's export of the pharmaceutical can do so by making good manufacturing practice mandatory for all pharmaceutical production and by training their inspectors in GMP requirement. Factory premises. Manufacturing plant should be adequate space for receiving and storing raw material, manufacturing process areas, finish good store and office. General requirements for the GMP manufacturing in Unani system: location and the surroundings, buildings, water supply, disposable of waste, containers, cleaning and stores. Raw material, it should be raw material of the metallic or origin. Raw material could be from the mineral origin, raw material from animal sources. Fresh herbs, dry herbs or plant part, excipient, etc. Packaging materials, finished good stores, working space, healthy clothes, sanitation and hygiene of the workers, medical services, machineries and the equipments, batch manufacturing records, distribution records, record of the market complaints and record control. So this is all the topics which should be come in the good GMP manufacturing of Unani medicine. Now come to we'll discuss the recent technological advancement in the Unani system of medicine. Digital innovation and technologies improve health through the application ranging from the individual use to wider usage by the healthcare system. Digitalization of the healthcare became unavoidable since medical knowledge grows rapidly in the form of electronic health records, archival of the patient data, and documentation of clinical evidence. Digital technologies are recognized in the scientific communities to achieve the sustainable development goals, health promotion, disease prevention, improving the accessibility of the delivery care system, quality and the affordability of the healthcare services. Digital Health Blueprint (NDHB) is encompassing the national digital health ecosystem that proposes to ensure the availability of the healthcare services across country. Traditional Knowledge Digital Library. Traditional Knowledge Digital Library is an important joint initiative of the Department of Ayush, Ministry of Health and Family Welfare, Government of India, Council of Scientific and Industrial Research, Ministry of Science and Technology, Government of India to prevent the biopiracy and misappropriation of the classical Unani formulation. It mainly aims at introducing Unani system of medicine to a global audience. E-book, Unani literature and e-books are present in different libraries. The field of e-books is an important department of IT. Presently, work is going on the completion of e-book of Canon of Medicine by Avicenna. Classical books available on Unani literature should be converted into e-books so that they can be accessed online by everyone. Libraries, science, literature of Unani medicine present in libraries of the world like Hagia Sophia Library in Turkey, Alexandria Library in Egypt, World of Congress Library in America, Williams Library in England, Khuda Bakhsh Library in Patna, Maulana Azad Library in Aligarh. Every individual will able to access their literature will be help of the library science. ResearchGate is a platform where Unani research can be upload their research papers so that the Unani system can be worldwide acceptance and the discussion on this topic can be made by the scientific and research worldwide. HL7 is standard software through which information can be transferred to different departments of the hospital. For example, if a patient is admitted at the registration counter, the information can immediately transfer to the IPD with the help of the program. DICOM. DICOM is nothing but the medical imaging like MRI, USG, X-ray help in diagnosis of the disease. These technologies are used nowadays in all hospitals, includes the Unani hospital. DICOM is used for handling, storing and printing, transmitting information in medical imaging. Current scenario of Unani medicine. Recent advancement in Unani system of medicine. In ancient times, Unani surgeons did perform several surgeries like general surgeries, proctoanal surgeries, obstetric surgery, brain surgeries, laparotomy, and plastic surgery, etc. Avicenna was the first to describe the intubation, and which is nowadays in advance in ICU, in emergency department. In case of emergency, we have to intubate the patient and we have to put it on the ventilator support. Bukrat given the principles and techniques for treatment of surgical diseases. For example, which in advanced management we are using these techniques, the management of the shoulder dislocation, pot spine. According to him, to the Bukrat, his most important book is Quatrimun, Tibbe Dukhan. There was 3 chapters. The book deals in detail for management of surgical disease by operation. Means operation, correction of errors by surgery, repair of fractures and dislocated bone by suture, reduction and immobilization and etc. As per the Bukrat, apart from them, there are many books dedicated to him, for example, Kitabul Jara, etc. Hippocratic corpus has 8 surgical treatises, constitute the category therapeutic writing pertaining to the surgery. So, these all are the topics which in advanced technologies invented in Unani system of medicines, trauma surgery, bone surgery, independent treatises, fracture, joints, graft, partly soft tissue surgery, wounds, non-trauma surgery, soft tissue injuries, hemorrhoids and the fistula, bone surgery, fracture in the joint, gynecological surgery, extraction of the dead fetus and abortion. So this is all evaluated from the Unani system of medicines, and in current advancement also occur in Unani system of medicine. As the previous Hippocrates described the diseases of the human rectum and their treatment, for example hemorrhoids. Now initially the scientists were treating for the hemorrhoids. Nowadays we are using the laser for treatment of the hemorrhoid. Cautery and excision are accounted in the Hippocratic corpus in addition to preferred the courses ligating the hemorrhoids and drying them with a hot iron. Other treatments use of the lubricant are suggested as well. Today treatment for hemorrhoids still includes burning, strangling and excising. The fundamental concept of proctoscopy outlined in corpus are still in use, which is advanced in Unani system. For example, the uses of the rectal speculum, a common medical devices, are discussed in Hippocratic corpus. This construction, the earlier accounted citation to the endoscopy. Now evaluation of the laparoscopy. This is the advancement which is occur. Ancient times, the Egyptian observation of the natural evaluation of the laparoscopy. Ancient time Egyptian observation of the natural of orifices. 19th century first endoscopy built with an external light source. 19th century first endoscope built and with external light source. 20th century internal light source, automatic insufflation. Extension to different discipline. Evaluation of technology implemented in laparoscopy. Evaluation of technology implemented in laparoscopy. The earliest references of endoscopy the date back to Hippocratic times. In his manuscript, there is detail of rectum examination with the speculum. In case of intestinal obstruction, injected large quantity of air into the intestine through anus. This is an advancement which is occur. He gave the idea of suppository, which is also in advancement. More advancement occur in the dissection of the cadaver of human being and animals involved in applied anatomy. Unidentified flow on urine from the renal to ureter by dissection of animals. Importance of diaphragm in respiration. Now the concept is used for resuscitation of the patient. The more advancement occur, which is originate from the brain and the spinal cord, this is verified the useful for anesthesia to relieve pain during the surgery. He divided muscles on the basis of their management like longitudinal transfers and oblique, which is helpful in the cosmetic surgery and their rapid healing. More advancement occur in the first category as per the Ibn Zohar. The disease that can be treated by medicines and lifestyle modification, for example, swelling of the tongue, uvula, intestinal obstruction, sterility, dental pathology, and varicose vein, initial stages of the piles, Peyronie's disease of the penis, endocarditis, uterine prolapse, and pulmonary tuberculosis and paralysis, etc. Category second, disease that can be managed by instruments like retention of urine, which is the advancement, bladder and vaginal infection, epistaxis, nasogastric tube feeding, placing mesh to treat the hernia, aseptic syringing, wash of the uterus, immobilization of the fracture. The third category, disease that can be managed by surgery like hernia, lithotripsy, hysterectomy, and tracheostomy, and Peyronie's disease, abnormal angulation of the penis. Around the years 1000 AD, he wrote his famous instrument made and used by the Abulcasis, surgical tools devised or utilized by Al-Zahrawi. These all are the ancient tools which were using nowadays, which is advancement occur and different surgical instruments are invented as per the previous instruments which were using. Like in Al-Tasrif, 3 chapters were devoted to the surgery. Some of the producers and techniques detained. In Al-Tasrif, 3 chapters were devoted to the surgery. Some of the procedures and techniques detailed in these chapters include the following: surgeries of the eyes, ear and the throat, tonsillectomy, tracheostomy. He devised instrument for the examination. He devised instrument for the examination of the ear. He devised as instrument used to remove or insert objects in the throat. He described how to use a hook to remove a polyp from the nose. He described the exposure and division of the temporal arteries to relieve the certain types of headaches. He utilized cauterization, which is now in advancement, usually to treat the skin tumors and open abscess. He applied cauterization procedures as to many 54 different operations. Application of ligature for the bleeding vessels and internal stitches utilizing the catgut, which is advanced in Unani system of medicine, claimed to be first European to be utilized the sutures. Now, recent advancement of the surgeries of the blood vessels. Al-Zahrawi wrote about the pulsating or non-pulsating vessels, which means that he was conscious about the difference between the arteries and the vein. He was the first. Arteries retracted when they are cut across, and if small, stop bleeding. Incomplete cutting of the arteries causes much bleeding. Arteries bleed from both ends when cut across. There is a possibility of late hemorrhage if wound do not remain clean. ENT surgery. In ENT, the advancement which is occur is tracheostomy. As per the ancient scholar, count 3 or 4 rings of the windpipes and cut the membrane lying between two cartilages and then attach the cartilages to the skin. For tonsillectomy, he said, depress the tongue by means of the tool, then insert a hook in the tonsil and pull it outward, and then cut it by means of strong scissor. Advancement in dentistry. Al-Zahrawi devised various types of forceps for extraction of teeth and described the fixation of the loose teeth by wiring made of gold or silver. He advised replacing the teeth that are traumatized out of their sockets because they may hold again. He suggested the use of animal bones for making false teeth. He treated eupilus by excision followed by cautery. Abu Marwan al-Malik ibn Zohar, the father of experimental surgery, repanation method. A hole is drilled or carved into the skull, thus exposing the dura mater in order to treat health problem treated health problem related to the intracranial pressure and other diseases. Harmonic scalpel is also the recent advancement also occur, which is already mentioned in ancient literatures. So this was a brief lecture in which we have discussed the current scenario in Unani system of medicine and which is globally accepted, and all over the world different wellness clinics are available for to treat the patient, like the disease of vitiligo, sexual disorders, skin diseases and other many more diseases we can treat through the Unani system. And we also discussed the efficacy of Unani drugs which are using for to treat the patient as per the Unani system. And also we have already covered the good practicing manufacturing points which are using for the betterment of the Unani drugs to use in patient, and the recent advancement in technologies which are elaborated from the ancient instruments which were used. Thank you so much for listening.